Hey everybody, thanks for tuning in to another episode of Seize Your Business podcast. My name is Bryan McDonald, partner at onPurpose Growth, and the reason why we started this podcast is because we wanted to give to the marketplace best practices, strategies, skills that actual business owners or high-level professionals in the marketplace are applying to their businesses, so you can take what you want, see what works for you, and use it in your business or wherever that ultimately would apply in your life to help everybody out there move the ball forward and start achieving whatever they want to achieve and hit whatever goal they want to hit. So if you'd like to learn more about myself or onPurpose Growth, you can go to onPurposeGrowth.com, or you can hit me up on my social media sites. It's linkedin.com/McDonaldBryan and or twitter.com/McDonaldBryan. We'll be adding some of my other social media sites to this in the future. And if you want to learn more about O'Flaherty Law, who's hosting the podcast, you can go to o'flaherty-law.com. Thanks, and here's the next episode.
The following BLTV program is brought to you by O'Flaherty Law. Please enjoy.
Hey everybody, Bryan McDonald here from onPurpose Growth with another Seize Your Business podcast. Today I have Mike Engelhardt of GCG Financial and Alera Group Company here, and what we're going to do is talk about seizing your healthcare and seizing your healthcare costs. So Mike, thanks for coming on, man. I appreciate it.
Welcome. Thanks for having me.
Yeah. So give me a little bit about your background real quick so that people kind of understand maybe a little bit about Alera Group, and then we'll kick right into this.
Well, I've been in the insurance industry for 20 plus years, working with employers. Mm-hmm. Used to want to get to 20 round up, but now I'm over. Right. So yeah, so over 20 years, and always been in the healthcare space, and been with GCG for now almost 6 years. And as a part of the Alera Group, we offer resources to employers for health and welfare, risk management, human capital, technology, a number of other resources.
Cool. And and you've been working with small and medium-sized business owners or decision makers in that space for 20 years, right?
Right. Exactly.
Yeah. Cool. So hot thing it's been for years, Mike, is how do people actually control their healthcare costs, and something you said is like, hey, I help people seize their healthcare in businesses. So what do business owners, decision makers, where do they even start thinking about that stuff?
Well, a lot of times employers think that I have to get quotes from the other employers that are out in the marketplace, or the other healthcare providers in the marketplace.
Yeah.
What they don't realize is that when you get a quote, it's based on your claims, and when you get that competitive quote, it's really just a matter of how low can I get the fixed cost at the other insurance companies. And what I say by seizing their healthcare is reducing their claims, and that's really where the opportunity is, because the rough estimate is 75 to 80% of your total healthcare spend is claims.
Okay, so just going through the practice of pitting a broker against each other, pitting insurance companies against each other isn't necessarily the complete picture on that's how you control your costs.
No, not at all.
Yeah.
Unless there's services outside of your healthcare costs that you're looking for now.
So help us understand, beginning to even think about controlling claims. But to me, it's kind of like just what happens, right? Or is that off?
So what everyone, since the beginning of the PPO, we've been trained to believe and get our employees to use the network of providers. Mm-hmm. And depending on what market you're in, there's normally one 800-pound gorilla, like in Chicago and Blue Cross.
Yeah.
But in general, they all have significant discounts, as opposed to if you walked in off the street.
Right. Okay.
What a lot of employers don't realize is that the cost of the exact same service at one place can be much different than at another place.
What do you mean by that?
So let's say you need to have an MRI done.
Okay.
And the way that billing is done with insurance companies, there's a particular code associated with the procedure. So
Okay.
let's say you needed to get an MRI done and your doctor said, yeah, go down to my hospital and have it done there.
Mm-hmm.
Well, that MRI might cost you $4,000.
Okay.
Okay. The exact same MRI with the exact same code at a freestanding MRI facility might cost you $400.
Really?
And they're both in network.
Okay. So are people assuming that the MRI facility is not in, or?
No, it's a matter of employees going in network, and a lot of times they'll just make sure that wherever their doctor recommends is in network.
Ah.
And even though there's other places in network, they don't give them a second thought because, well, they're going to go where their doctor recommended.
Right.
What they don't see is the cost associated with that, and that can vary by 1,000%.
And the doctor really isn't focused on cost. The doctor is just focused on getting the MRI done.
Yes and no.
Oh,
So
okay.
lately you've heard a lot about doctors getting paid based on their outcomes, and
Okay.
and you see a lot of consolidation with hospital systems. Well, that's partly because insurance companies want doctors to take better care of themselves
Okay.
and of their patients, excuse me.
Yeah. Okay.
But what that also means is that they're getting paid a little bit for every member that they have attributed to them. So that's why
Really?
you're seeing this expansion in systems, because the larger of a footprint you have,
Yeah.
then that means you have more patients under your umbrella. So doctors are becoming more incented to keep those patients within their system. And you hear about risk-bearing arrangements where the system is a risk-bearing arrangement. Well, when it's risk-bearing, they want to keep them in the system. And a lot of times when you have invasive things done, well, they want to keep them at the hospital, even though there might be a freestanding facility that could do something for a tenth of the cost.
What do you mean by risk bearing? Meaning, if I got to get this person well or keep them in the system, what's risk bearing mean?
So these hospital systems are
Yeah.
now, they have a relationship with the insurance company to where, based on the health of their population under their umbrella, they're getting a portion of their outcome. So if it's a good outcome and they're rated as a good provider, then there's a portion of that they get back. It's like results based.
Yeah. So they're get them. How do you say this backwards? Get them healthy faster, and you got some money back.
Do a good job, you get money back. It's
Yeah.
results based. So in theory, that's a great idea. But what happens is now your general doctors are incented to keep doctors in the system so they can track them. But what that means is that when you have that MRI done, that knee replacement done, and you just stay in the system as opposed to going to the best place at the lowest cost, the employer's bottom line or their loss ratio can be affected by 20 or 30%.
So as this system changes and grows, it sounds like it's getting almost worse. Maybe that's bad. way to say it.
It's more complex, and the challenge to reduce costs is that much greater.
That's what I said, right? Exactly. So, so is it just things with like an MRI? I mean, that seems like a pretty expensive, hefty, complicated. What about other things?
So when you're talking about MRIs, CAT scans, those types of things, those are just services that need to get done. And yes, those happen a lot. So from a frequency standpoint, that's some low-hanging fruit for an employer.
Mm-hmm.
You add things like knee replacements,
Okay.
hip replacements. That's where cost is important, but outcomes is even more important.
Okay.
So if you're going to get your hip replaced, you want to make sure it's done the right way the first time.
Mm-hmm.
So, and something like that could be $20,000 or it could be $100,000.
Oh.
And initially people will think, well, I want to spend, the doctor that does the best is I'm going to have to spend the most for, but it's actually the inverse relationship. So if you think about cars, the better the car, you're going to spend more money on it. But actually with medical care, it's kind of like widgets. You know, the more widgets you make, the lower the incremental price.
Yeah.
The more hip replacements you do, the better you get, the less time it costs, and the less doctors charge in general.
So a true specialist ultimately could be cheaper.
Moderately to lower cost, yeah. The initial assumption shouldn't be, it's okay to see the high-priced doctor.
Because the high-priced doctor, maybe, I don't do this a lot.
Maybe. That's maybe too much of an assumption.
Yeah.
But, yeah, I understand what you're saying.
Yeah. So, I mean, how do employers handle this? Because I know somebody listening and watching this is thinking, I don't have time to manage every single decision of my employees, especially no matter if I got 20 employees or 200 employees or 2,000 employees.
Right.
How in the world do I manage this?
So believe it or not, the biggest challenge for employers is getting employees engaged in the process.
Yeah.
The weird thing about this is that if you go to a group of employees, whether it's 20 or 200 or 2,000, and say, do this to save us as the company money, because it's going to save you money, that becomes white noise for whatever reason. They just don't hear it. So insurance companies have come out, and if you go on every single website at an insurance company, you're going to find a place where you can see the costs and the outcomes of services.
Okay.
Okay? Getting employees to log on and register and to find that is a completely different story. So there's become a cottage industry of third-party systems to where they're like a concierge. So employees can call in and they can get their benefit information, what's my deductible, what's my co-insurance, but at the same time be given insight into what providers are available for what they need to have done, what the cost and quality scores are, and just letting the employee be a consumer, which they would naturally do, without even mentioning the fact that this is saving the employer money and probably ultimately bringing their contributions down.
And so contribution of the employer and the employee?
So what I hear a lot is from employers is we want to bring costs down to the employees, but we can't do it unless our costs are brought down.
Yeah, right.
So you bring the overall cost down, and it's an easy decision for an employer to bring the employee cost down.
Got it. And two, these concierges, because I know people are probably like, I hate calling insurance companies. This is not the insurance company. It's a third party that knows the plan.
So there's third parties that are out there that know the discounts and quality scores of all the insurance companies out there, all the networks out there. So it's interchangeable regardless of what insurance company you have.
Yeah, so it's not, hey, go into the black hole of BCBS, just
Right.
call these people and you'll get somebody that knows what they're talking about, specifically about what you're looking for, not, asking you.
Yeah, based on your plan design, your
Yeah.
copay, deductible, out-of-pocket copay, stuff like that.
Interesting. So, is it, I'm thinking you probably have to be a large size employer to take advantage of these plans, right? Or am I right, wrong?
Not really.
Okay.
The best example I can give you most recently is a client of mine that was self-insured and had 80 employees. And they came to me and the CFO and the president were in the process of buying the company. And
Okay.
they said, unless we can get our healthcare costs down, we're going to let private equity buy it. We're not going to buy the company. So I went in and I redesigned the plan design. So meaning instead of an in and out of network, I had a third tier that was all about discretionary care. So when there was a discretionary service to be done, it paid benefits a little bit differently, got employees engaged, and then we added that third party service.
Concierge. Concierge.
Yeah, exactly. And the impact to cost was 25%. So they ended up buying the company after the expected results that we were supposed to get, and we ended up doing a little bit better by the end of the year.
And this isn't just making costs go down once, right? Like you have a good broker that you didn't just do a really good job negotiating with the insurance companies. You actually made a change, right?
Right.
There's a difference.
All right. You go out to market, and an insurance company gives you a 20% lower cost in the first year, and then you see them go back up the next year.
Right.
No. So with this particular example I gave you, their costs went down, and then they sustained that savings for 2 years. So as opposed to 7 or 10% increases every year, they saw virtually no increase in going into the second year.
And so this gave these guys the ability to actually buy the business.
Yeah, and it really kind of gives rise to like another angle for this.
Okay.
Meaning, if you're an owner and you're looking at selling your company in the next few years, you're going to want the greatest sale price.
Yeah.
Okay. So if you look at decreasing your costs now, looking over a 5-year period of time, I had a client, roughly just over 200 employees. We showed them an increase in value over a 5-year period of time of over $4 million.
$4 million for his pocket, or their pocket.
Yeah, I mean, depending on the multiple that the company's going to be offering.
Right.
At the end of that 5-year period of time, their costs were $500,000 lower, and at an 8 times multiple.
Yeah, that's how you seize your healthcare and your business, right?
Right.
Well, cool. I appreciate you coming on, Mike. Shared a lot of stuff that's actually actionable, not just hypothesis for everybody. So I appreciate you coming on and sharing. So everybody, thanks for viewing this last episode of Seize Your Business. Learn how to seize your healthcare. Please join us next time. And if you'd like to get a hold of Mike, all his information will be shared. Learn more about him. Learn more about GCG and Alera Group and what they can do in the marketplace for you or somebody you know. Thanks, guys. Hey, everybody. Thanks for tuning in to this last episode of the Seize Your Business podcast. Again, I'm Bryan McDonald from onPurpose Growth. We're grateful that you took the time to listen or watch this episode of the podcast. If you have any questions, concerns, comments, want to talk about how you liked it or you disliked it or completely disagreed with it, comment below wherever you're watching this video or listening to this podcast. We welcome all and any feedback. And if you would like to engage with me directly, you can or follow me on my social media sites. My LinkedIn is linkedin.com/McDonaldBryan. My Twitter is twitter.com/McDonaldBryan. And also, if you want to learn more about O'Flaherty Law, who hosts this podcast, you can find them at o'flaherty-law.com. Again, thanks for joining us, and we look forward to having you back on the next episode. Take care.